The next system that I want to look at is the special sense associated with taste. And as we have done so many times is I want to look at the basic anatomy of this system, and then we will spend time looking at the pathways associated with this system. The sensation of taste is sensed by the taste buds. And taste buds are primarily located in the tongue. But taste buds can also be found in the oral cavity. They can be found in the upper throat, etc. So, most of the taste buds we always identify as being within the tongue, though. When we look at a taste bud, we are first of all going to see the sensory cells. And the sensory cells actually are the cells that can take chemical information and give us action potentials. What is interesting is that you can tell the age of the sensory cell based on its staining characteristic. The lighter the cell, the younger that cell is. Then we're going to have a series of cells which are the support cells. These support cells are glial-like cells, and so they're going to take care of the maintenance of the taste bud. And then finally, we have the basal cells. The basal cells have the ability to mitose and form either sensory cells or support cells, depending on what that taste bud happens to need. As long as the basal cells are still intact, we can regenerate taste buds. So if there is an injury to a taste bud, as long as that injury does not take out all of the basal cells, that taste bud will eventually regenerate. When we look at the tongue, we are going to see that, first of all, the anterior 2/3 of the tongue is going to have taste innervation through cranial nerve 7, specifically the chorda tympani part of cranial nerve 7. The posterior 1/3 of the tongue is going to be innervated by cranial nerve 9. And then finally, the root of the tongue, or sometimes referred to as the epiglottic tongue, is going to receive sensory innervation for taste from cranial nerve 10. You'll remember that the taste buds are going to be located in the papilla of the tongue. We're going to see that taste buds will be found in the fungiform, the folate, and the circumvallate papilla. Although this map is an old map, and some authors no longer believe that this map is true, I'll show it to you anyway, and that is the tip of the tongue is associated with the sweet taste. The anterior lateral tongue is for salty. The posterior lateral part of the tongue is for sour, and then the posterior aspect of the tongue is for bitter. Again, as to whether or not this map is still true is up for debate, but it is a classic and I thought you should at least see it. I want to look at 3 pathways associated with the sense of taste. The first is for taste perception. And as such, if we are talking about the perception of taste, this information has to go to the cerebrum. So what I'm going to do first is I'm going to draw in here a nucleus called the solitary nucleus. The solitary nucleus is kind of like the clearinghouse for all information relating to taste. From there, now we're ready to draw in the neurons. So first of all, I'm going to have a taste bud. And that taste bud is going to be found in the anterior 2/3 of the tongue. That taste bud is going to come in through cranial nerve 7. It's going to have its cell body in the geniculate ganglion, where it will project then to the solitary nucleus. Then I'm going to have a taste bud. This is going to come from the posterior 1/3 of the tongue. This is going to use cranial nerve 9. And its cell body is going to be located in the inferior ganglion of cranial nerve 9. It is going to project to the solitary nucleus. And then finally, I'm going to have taste buds coming from the root of the tongue. These fibers are going to be using cranial nerve 10, and their cell bodies are going to be in the inferior ganglion of cranial nerve 10, and they are also going to project to the solitary nucleus. All of these nerve fibers are going to be passing through the solitary tract to get to the solitary nucleus. From there, I'm going to have neurons that are going to come out of the solitary nucleus. These neurons are going to ascend in the central tegmental tract, and just like any other of our sensory information, these are going to go to the thalamus. Specifically, these are going to go to VPM of the thalamus. And then finally, coming out of VPM, I'm going to have nerve fibers that are going to go through the internal capsule, and these nerve fibers are going to go to the gustatory cortex. And the gustatory cortex is made up of area 43 and the insula. So this is our pathway for taste perception. And again, the important thing to always keep in mind is that if we're going to perceive something, it has to go to the cerebrum. For testing purposes, you will only be asked to draw one of the first neurons in the system. In other words, the question will be worded in such a way that you will be drawing from either anterior 2/3 or posterior 1/3 or root of the tongue.